Hi everyone. So I'm Matan Singer. I'm the new research coordinator for Mobilizing Justice. And while I'm speaking, I'll just share the slide. Last session today, we have three very interesting um, presentations, but by three of our PhD students. Um, they're all different methodologically and conceptually. So I think it's a good combination. I'll share a presentation of each recording of each presentation, and then we'll have a few minutes for questions. So we have Brenn Anderson-Gregson, who's a PhD student at the University of Toronto, who will present on enhancing equity in transportation infrastructure planning, an analysis of disparities in spatial access to select destinations in Canada. Paromita Nakshi, a PhD student at the University of Toronto, traveling in the margins, impacts of transport poverty on travel attitudes and behaviors. And Bruno Santos, a PhD student at McMaster University, will speak about a standardized methodology to assess job accessibility in Canadian cities. So I'll just start the first presentation, and then we'll have time for questions. Find it.
Sorry, Matana, we don't hear the audio.
I was concerned about this. Any advice on what I'm doing wrong?
When you share
You,
screen, there's a check mark that says share sound as well. If you check that off, you
Right, you told me about that and I forgot.
yes.
So I'll reshare it. Sorry about that. Share sound. So take two.
All right, so today I will be talking about enhancing equity in transportation infrastructure planning. This work is from a paper that was just submitted to the School of Cities and Canadian Urban Institute issue on the infrastructure deficit in Canada. So the impetus for this paper was really identifying a gap in the research that found that most evaluations of transportation inequity tend to only use a single mode of transportation or a single equity indicator, for example, income. Likewise, very few assess equity in access to multiple destinations and by sustainable transportation modes, and especially at a national scale. So the research question that came out of this was really just what would a national accounting for transportation equity using multimodal, multi-destination, and multi-population group look like, and what would it tell us about the state of transportation equity in Canada? So to do this, we utilize the Statistics Canada Spatial Access Measures, which is a recent data set of accessibility indicators that includes 7 destinations and 4 different modes. And it uses a scaled gravity measure from where 0 represents the least access to that destination. In most cases, that means no access, and 1 represents the most access. And this is for the entire country and is done at the dissemination block level. So a pretty fine spatial unit. So we can see from the distributions of each of the scores, they're all very right skewed, which means majority of Canadians are at the lower end of access to these destinations across all of the destinations and all of the modes. And so to evaluate the equity implications of this, we implemented the Foster-Greer-Thorbecke indices. It's basically just a unified calculation for evaluating transportation disadvantage rate and severity by subpopulation. For both rate and severity, scores closer to 0 indicate quote unquote better score, generally that a lower proportion of people are in those low access areas, or it's a lower severity, and a score close to 1 is a worse score with a higher proportion or a higher severity. So implementing these on the spatial access measures database, we calculated a FGT score for every mode, for each destination, for each population, for each spatial unit that we were interested in. And doing so, we were able to plot them and visualize them in a way to start pulling out patterns and insights about the state of national transportation equity. One of the benefits, but also one of the complexities of this method is the amount of data that it produces. Only looking at the national scores creates about 140 data points for all of these different levels, but adding in scores for every single CMA increases that to about 6,000 data points. And so within this, and in the paper, we go into different crosscuts and different dimensions to start pulling out these trends in a variety of ways about the state of Canadian transportation equity. But for this presentation, I'm going to focus in on what I think is one of the key findings of that. And to do so, I just need to focus on a single component of this. And that's going to be the cycling access to employment. So recreating that chart, but just focused in again on cycling access to employment, we have the 5 different population groups with the disadvantage rate. So there's a tendency in transportation equity analysis to only use one indicator and to focus on low income as an indicator of transportation equity. But as we can see here, this relying on that single indicator doesn't tell the full story. In this case, low income is the lowest disadvantage rate of any of the 5. And not that it's not an important component, but only looking at that dimension is going to remove a lot of the story. Even adding in just housing burden, which in many ways is also an income indicator, it's about 10% higher on the disadvantage rate, which even just starts to add a little bit more understanding of the spatial layout that is contributing to these scores and how income is a factor. And so in addition to including multiple subpopulations, we also found that different regions and different scales also show different trends as well as the different population groups. And so looking at these national disadvantage rates, general trend is moving from the left to the right. There's an increase in the disadvantage rate for each population going forwards. But we found that if you disaggregate this to the regional level or even further, an interesting trend of nested patterns start to emerge. So if we look at the regional scores disaggregated, what you see is the same national scoring is still there. It's still roughly increasing from the left to the right, but we add in a little bit more nuance. Looking at the Atlantic regions, for example, we see that they tend to be a little bit more on the extremes. And by that, I mean for the population groups that are below the threshold, they are quite a bit further below the national level scores. Whereas for the population groups above that 25th percentile threshold, they are quite a bit above. So it's diverging quite a bit from the mean in either direction. The West Coast, on the other hand, for all 5 population groups is roughly equal to or much higher in terms of disadvantage rate compared to those national scores. Similarly, for the prairie provinces, we see almost the same trends of higher scores across all the dimensions, except for the indigenous population, where the disadvantage rate is lower than the national trend, and it's also actually the only region that is below the threshold. Although it's not that much lower, this is still kind of places it at a unique point compared to all of the other regions. And so moving forward, if we disaggregate again, this time focusing in on the prairie provinces, we can look at each of these scores by the CMA. And that same nested trends occurs here again, with the rough national trend still being present, adding in the drop in the disadvantage rate from the indigenous populations for the region. But then we are also adding in a bit of variation from the CMA level scores as well. And this is kind of in two ways. Looking at low income, housing burdened, and extreme commuters, there's definitely more variation, but it's still relatively clustered with these kind of broader similar trends of CMAs having higher or lower scores. But if we focus on Black and Indigenous, we see a lot more variation, not only between the CMAs, but also between the scores for the same CMA. Looking at Red Deer, keeps that regional trend between extreme level with the highest Black disadvantage rate and the lowest, one of the lowest Indigenous disadvantage rates, compared to Edmonton, which has the lowest Black disadvantage rate and the highest Indigenous disadvantage rate, which is a complete reversal of the regional trend. So even though we're just looking at 5 subgroups here, we see these nested trends that kind of tells the story going from the national level down to the CMA level. And it also really, I think, pinpoints the need to look at different population groups, and particularly to add that local understanding of what population groups should be looked at for a particular region or for a particular CMA. And this, of course, can be done using the MJ transportation equity dashboards. Uses the same data that was used in this analysis, and the FGT calculations were actually built into it. So in a dynamic and interactive way, so that you can look at FGT scores across different geographic scales, across modes and destinations, and perform similar analyses with different population groups, or focus in on a specific geographic area. So the key takeaways, I hope, are just that the FGT indices combined with the SAM data are a very powerful tool for evaluating transportation equity, just in general. Also, the income alone is not sufficient to account for and evaluate transportation equity, and it really needs more population groups and indicators to understand the full story. And then part of that, the population groups, as well as the regions, show different patterns of transportation inequities. And so that multi-scalar approach really is important to understanding the full story.
Thank you very much, Brenn. I think we have time for a few questions. I saw that there was one question about if the data is available. I think you answered it in your presentation, that it's on the dashboard, so you can use the dashboard to. You just need to unmute.
As Jamie pointed out in the chat, it is available from StatCan and then also built into the dashboards. It is pre-calculated, so like the specific destinations isn't available, but the access scores to those destinations is.
There's another question by Colleen about breaking this down by hidden and visible disabilities. Is that an option in the dashboard? Is there data on it?
I am not sure about that, actually.
We'll have to check, I guess, or play with the data and the dashboard and see. Well, people ask more questions in the chat. I'll ask, because you showed us results on cycling to employment. Are results for other modes and other destinations similar, or do they differ? Can you share about the variation in types of modes and destinations?
Yeah, so what we found, there's I think a lot of correlation between the modes, like within a specific destination. So there's very similar trends like for public transport access to employment as there is for cycling, as well as walking. I think when you dive into the different destinations, there starts to be kind of some more differentiation there. Especially we noticed like grocery stores has a very different access pattern than employment, which there's kind of quite a few of the destinations look very similar to the employment access, but then grocery stores and schools as well show very different patterns that I think are related to the zoning and planning decisions that go into where those are located. What he did find, however, is I guess kind of like the trend in the trends is very present. So different regions might have a different trend for each destination type, but there is kind of that nested patterning across all of them. Just the specific trends that are found might be different.
And maybe last question. Did you check intersectionality? For example, an extreme commuter might be Black, low-income person. So the cumulative burden for social identity might be higher than only race class based on disadvantage.
Yeah, so for this one, we only looked at kind of the single access or single population types. We're using census data at the dissemination area, which they don't really have the intersectionality data at that level. I think it would be very interesting to look at that, and especially to see how compounding factors might increase or decrease levels of transport disadvantage. But I don't. There's not a public data set for the entire country that we could do it at the same spatial granularity that we were focusing on for this one.
Okay, great. So I think we can move on to the next presentation, and then if there are more questions at the end, then we can come back to that. So next we have Paromita. I'll just share her presentation.
Hello, everyone. Thanks for joining today. My name is Paromita Nakshi, and I'm a PhD candidate at the Department of Geography and Planning, University of Toronto. Today, I'll be presenting a part of my PhD research, which is titled Traveling in the Margins: Impacts of Transport Poverty on Travel Attitudes and Behavior. And this research is supervised by Professor Karen Lucas from the University of Manchester and Professor Stephen Ferber from the University of Toronto, Scarborough. So first, a little bit about the background of this research. So according to social psychological theories and travel behavior, positive attitude towards a certain mode possibly impacts the decision to use that mode and vice versa. And travel attitudes are considered crucial in sustainable travel demand management and land use policies. Existing research in this area generally focus on built environment, residential self-selection and dissonance, reverse causality and travel attitude change, as well as role of habit. However, we do not adequately know if social and transportation inequities impact the formation and change of travel attitudes, because if they do, then inequities impact travel behavior not only through material deprivation, but also by influencing travel attitudes. In this research, we use the concept of transport poverty, which is defined as the combined effect of transportation and social disadvantages. For example, you do not have a car, which is a transportation disadvantage, as well as if you live in low income. That means you do not have access to a lot of services and facilities and possibly experiences social exclusion. In this context, the aim of this research is to explore whether transport poverty contributes to the formation and change of travel attitudes and behavior. To answer our research question, we conducted a qualitative study with retrospective elements in Rexdale neighborhood in Toronto. Rexdale is located northwest of Toronto and characterized by low income, diverse racial demographics, and poor public transport infrastructure and accessibility. We conducted 4 focus group discussions and 20 follow-up interviews with adults living in Rexdale for at least 5 years. They also experienced precarious financial situation at the time of data collection or in the recent past. And all the participants also used biking, public transit, or walking as their primary travel mode. Majority of our participants were women, and among the interview participants, 95% were from visible minority population groups, 10% had some form of chronic illness or disability, which prevented them from using the conventional transit services regularly, and 5% owned a car. Now I will share some of the key findings from this research. First, we found that participants frequently traveled at the intersection of race, gender, poverty, and poor quality of transportation. One participant tells us, "At times I want to go out and I'm looking at my purse. There is no money. So many times I decide to stay." Another participant talks about his experiences of traveling as a person of color. "I think even during a bus ride, there are some people, especially white people, who wouldn't want you to sit next to them." One female participant talks about her experiences of traveling at night. "At that time, you were scared also to take any traveling alone. I feel scared to take cabs at night too." And this experience was often lead to inaccessibility and social exclusion for these participants. "I had this appointment, I didn't have funds, didn't have money for transportation. Happened twice, I couldn't get the job." And the participant tells, "Most times at night, it's kind of really hard to actually have buses that you get used for whatever plans you have that night." And that is even after when Toronto has the Blue Night bus services. And these persistent experiences of racism and poverty often makes them normalized. One person says, "Well, I think that financial difficulties have been kind of common for us, like low-income people." And while talking about racism in public transit, a participant tells us, "It isn't really the first time, so And these transport poverty experiences affect travel attitudes. One participant tells us, "If I'm going on a bus on my journey, people normally look at me and I feel I have done something to be looked at me in the bus. I feel I don't belong to them." And the participant shares his experiences of using public transit as a person of color, that it is brutal and slow. So participants frequently mention feeling extremely judged, different, and not belonging to them as they experience this subtle racism and racial looks from other passengers in public transit. And this affective otherings had a powerful impact on them, as even brief encounters like these can really indicate a narrative of us versus them. However, travel attitudes are nuanced and may seem contradictory. Participants also had positive attitudes towards transit and believe that transit has been a lifesaver for them, and walking, biking, and transit have significant environmental and health benefits. And these contradictory attitudes might be explained by the context-specific understanding of attitudes and the salience of certain underlying beliefs compared to others in creating the attitude towards that particular experience. Now, coming to travel behavior adaptations, we found that these transport poverty experiences have impacted their travel behavior adaptations. And we found that daily mobility or lack thereof, particularly in face of socioeconomic and transportation disadvantages, is often dynamically and spontaneously adapted rather than being predetermined. And their travel behavior are actually frequently characterized by expected uncertainties. One participant tells us, "I just start walking and walk as much as I can, and wherever I catch a bus, I enter the bus." And other participant shares about her experiences of sharing cab with strangers, as "You can't wait. then you have to arrange for some cab or something, like the people who are also standing at the bus stop because the bus is really late. And at the same time, in response to these travel experiences, there are some non-immediate travel behavior changes. And these changes in the non-immediate future occurred through more careful planning than dynamically adapted mobility. And these changes often occurred with key life events. For example, a change in employment status or income, birth of a child, moving out of parental home, death of a spouse, or health condition. And such key life events effectively alter the degree of transport poverty the participants experience. For example, increased income might mean reduced transport poverty, whereas health issues can mean increased transport poverty. We found participants prioritized comfort and timeliness and sought certainty by opting for ride-sharing services or taxis when necessary when they had increased income, particularly for important work or medical trips or when traveling with toddlers. And participants expressed a desire or plans to purchase a car in future as they attain greater financial stability. Some were actively saving money to buy a car, and they believe that owning a car will provide greater certainty and freedom of travel, eliminating the need to wait for buses or miss desired activities. And at the same time, very importantly, they felt that having a car will help them not experience such incidents of racism in public transit and be a source of safety and prestige for them. And finally, there were cases of no adaptation or change as participants were frequently forced to stick to unsafe, unreliable, and uncomfortable travel patterns due to transport poverty factors that prevented them from carrying out their intended behavior. One participant shares his helplessness and about continuing using public transit even after persistent experiences of racism. But I had no option. How will I get to my workplace? How will I get to school? So I just had to go back to public transit. So a quick recap of the summary of key findings. We found that transport poverty experiences influence travel attitudes, and intersectionality of marginalization exacerbates vulnerability in daily travel and influences attitudes and travel behavior. Also, daily travel behaviors of individuals living in marginalized conditions are more ad hoc and dynamically adapted than existing literature suggests. We also believe that exogenous interventions are unlikely to yield significant success in travel demand management in the long run if people's past experiences with the transportation system are not favorable. We think future research should expand beyond accessibility metrics to include transit service affordability, frequency, and reliability metrics. We also need innovative approaches to capture travel behavior other than the traditional ones, as well as more nuanced understanding of travel attitudes. We also think quantitative methods to further examine and expand our findings will help. Here are some of the references that I used in this research. Thank you so much for listening. And if you have any questions, I'm happy to answer. Thank you so much.
Thank you, Paromita. That was very, very interesting. I think we have time, interesting and important work. I think we have time for a few questions. Couldn't check to see if there's anything in the chat. I don't see anything specifically. So I was wondering, and then maybe people can upload questions as they come up. Okay, there's one comment. Do you think that, here for me, that this is due to qualitative methods, the nuance to transport poverty that we often see in the literature? Do you think that this is due to the qualitative methods, and what are the implications to how we integrate these insights into practice?
Yeah, thanks, Madan, and thanks, Leah, for your question. First, yeah, I think the qualitative methods really helped us get some more nuanced findings. And as a researcher, it was a very enlightening experience, I would say, because when I started conducting the focus groups and interviews, I started with somewhat different expectations based on the literature, and didn't really expect a lot of the findings that we found. And so this actually the qualitative methods really helped. And in terms of the implications, I think that there is a long road ahead, because this is a question that I was thinking that how do you actually integrate these insights into practice? One thing that I really believe is that we need, as I also put in my future research direction, is that gradually we need to move beyond the one-day travel surveys or travel surveys that just focuses on or capture only the primary mode and travel time and so on, and maybe try to tap into, can technology help us? Can we design some form of app that does not rely on people remembering what they did last week and how the travel occurred? Instead, like just they're going on with their life, and it captures, okay, how long did the person actually wait at a bus stop? Did they had to take a detour and things like that? Maybe something like an app like Strava, but more adapted to our daily travel behavior, and tapping on those type of potentials can help. And at the same time, I think this is just one case study area, and I do not expect the experiences to be exactly the same in somewhere else, maybe in Scarborough or in downtown. It can be different as well. So we need more local level research and see what are the patterns emerging, are there spatial differences, and those sort of things. I also didn't find a lot of gendered impacts in their travel, and there might be different reasons for that, because it is difficult for racialized women to actually pinpoint whether the harassment was due to the race or due to their gender, or it might just be due to the race more. So those are the areas that are still really untapped. So I think we need more local level research to understand the dynamics and find better ways to capture travel behavior in future. Sorry, again, long answer.
Maybe just a quick last question. What were some of the surprising outcomes that you found?
Okay, surprising outcomes. One was, I think, when I started the research, I approached from perspective of hypermobility. So I thought everyone will always want to travel, everything will be bad for them. But that is also something they really showed a lot of appreciation for transit or walking or biking or how things are improving, which was really great. Even after all the problems, they're like, okay, the frequency, the bus is less crowded nowadays than 10 years back. There are more frequent bus services and so on. There are more bike lanes. So those are a lot of the things that people really appreciated. That was one thing. And another thing personally, and I will acknowledge that the case study area is not an area where I frequently travel. So as I'm a woman of color, I didn't actually experience that much racism in public transit, and I'm someone who uses public transit pretty much every day. So I think there's some kind of spatial aspect, or the transit operators that are operating on particular routes, they might be very different from somewhere else. And so a lot of these experiences are probably due to those patterns, and something I did not really expect people to talk about racism in public transit so much. But again, that was due to my experience and the literature, because there's not extensive literature on racism in public transit in Canadian context. There are some, but I think there's like not enough. So yeah.
Great, thank you very much. That was very, very interesting. And I think here is a good place to stop and move on to the last presentation of the day. So we have Bruno Santos from McMaster, and I'll share your presentation, and then we'll have time for questions.
Hello, I am Bruno Santos. I am a PhD student in geography at McMaster University, being supervised by Dr. Antonio Pais, and I am one of the researchers associated in the Mobilizing Justice Partnership. And the title of my presentation is A Standardized Methodology to Access Job Accessibility in Canadian Cities. Well, starting with a little bit of context, the primary benefit of transportation system is improving accessibility, understood as the ease of reaching destinations and opportunities. And opportunities, when we say, we can be referring to employment, healthcare, education services, and parks, and many other opportunities. But in this case, I will be dealing specifically with accessibility to employment or job accessibility, which is considered a key indicator to understand the way a city serves its residents, because employment provides the financial ability to support other life activities. Important to remember that poor accessibility is related to social exclusion, and when it is associated with other factors, can result in transportation poverty. However, when we talk about Canada lacks standards and objectives to ensure the equitable distribution of the transportation infrastructure. Transportation planners receive a little formal guidance to access and to evaluate the equity implications of their plans and projects. There is also an absence of transportation data in the form of open data products to help transportation planners, but we know that the data that can help us ensure equity in planning has never been more available. So thinking about that, I created the Commute CA. The Commute CA is a R package with a standardized methodology to calculate job accessibility for any Canadian city and regions. But what is a R package? Our R package aims to expand the functions of the software R. So the software R is a software mainly used for statistics, but in your case, we want to expand its functions to be able to apply accessibility analysis, to perform accessibility analysis. We also use our package as a way to teach, to register methodology, and also to share the data. The Commute has the census of population as the main data source. The census of population, important to say, it is a restricted data. To access this data, you need to have access to a research data center with authorization to use the census data. Research data center are office from Statistics Canada, and these offices, they manage the access of the surveys from Statistics Canada. The Commute provides notebooks covering topics ranging from introduction to R to job accessibility models. Besides, we are talking and we are processing census of population. The Commute also has testing data where you can access the package and apply the methodology before having access to the census data or before going to the office to work with the original census data. And what is accessibility model? Well, it's a location-based measure that calculates the level of accessibility of an area, and the result of accessibility model is a value assigned to each neighborhood. In this case, we have the job accessibility in Toronto, considering the transit mode. We can see the number of jobs accessible in a 45-minute transit trip. In yellow, we see the areas with higher levels of accessibility, and purple areas with lower levels of accessibility. The yellow areas or areas with higher accessibility are concentrated mainly in downtown Toronto or in areas well served with the Rapid Transit line. In this case, is referring to the subway. The Commute CA was thought to be applied in two locations. In the case that, considering that we have the census data and the census data has a restricted access, not all methodology need to be performed in a research data center. The RMcDowell 1, 2, 3, and 5 can be executed within your personal office, for example. The first R Markdown, we will talk about the basics of R and the concepts of data. Then we will perform some exploratory data analysis. We will calculate the travel time matrix. Then we will go to the research data center and calculate the accessibility measures, and then we'll be able to visualize accessibility measures. Also important to remember that if you do not have access to the research data center, you can perform all the methodology using this testing data. But important to say that the testing data was created randomly just to be able to perform the accessibility, but the data do not have a real meaning. So showing a little bit of the website. So this is the website of the Commute CA, our package, and introduce the package and also says about the structure and also present how you can install the Commute CA. Well, you can also see the GitHub repository where you can access the notebooks. The data row folder contains the notebooks to perform the methodology. Each session presents a RMD file and also a HTML file. The RMD file is the file that you can open in R, and this is the view of our Markdown in RStudio. Here we can see some text that we are actually communicating and explaining to the person, to the analyst, but we also have the parts that we are talking with the computer, where we are actually processing the data. As I said, every R Markdown has its RHML version. So this is the case of the HTML version of the fifth notebook, visualizing accessibility measures. In this case, we are producing maps from the accessibility measures that we calculated. Important to say that in this case, I am also using the testing version, the testing data. And the analysis is considered 4 types of transportation modes: the bike, car, transit, and walk. Well, returning to my presentation and already ending my presentation, the next steps are construction of tables, and these tables will aggregate job and labor force counts for metropolitan areas and census agglomeration. So a person will be able to perform accessibility the accessibility analysis without having to go to a RDC, to a research data center, and be able to perform all the analysis without having access to the census data. We also aim to advance in understanding how the transportation system can act as a barrier for those looking for or keeping a job. And we also aim to understand how accessibility level of an area related to employment outcomes, for example, employment status and job interview attended. Well, this was my presentation. Thank you so much for your attention.
Thank you very much, Bruno. That was very interesting and important, and I'm sure that there are many in the audience here that will find this useful. I see that there's already one question in the chat. Could an urban planner then use the same job accessibility models to model access to other destinations like grocery stores, medical services, etc.?
I would say that no. Actually, this package was done to analyze only job accessibility. Of course, then in general, a person would try to do the other activities close to the job or either close to its resident, but in this project, I was focusing in job accessibility only.
Okay, great. Any more questions? My question is about using data that doesn't require accessing um, um, specific research center, kind of that you can do just from your office. How would that work?
So, for example, right now we can perform the analysis using the dissemination area, but the idea would be trying to aggregate the data in another level, in another geographic level. So, it could be, for example, the census tract, or even create a cell, which would be a regular spatial unity where we could transfer the data, making sure that it would not be possible to identify a person who responded the census. So the idea.
But just be a little bit more aggregated for privacy reasons.
Yeah, exactly. Provide another type of aggregation of data.
Excellent. I think that if there aren't any more comments or questions in the chat, then we will end it here. Thank you very much, Brenn, Paromita, and Bruno for these excellent presentations.
Okay, yeah, so thanks everybody. We're ending a bit ahead of schedule, I think. Am I right about that?
Yes.
Okay, so yeah, just a big thank you for attending our symposium today. It's lovely to see you all here. I think at the high point this morning, we had more than 140 people here, which is great for us, and lots of interesting questions and comments throughout the entire afternoon. And so thank you for that engagement. And I know that a lot of our researchers will take that away and influence what we do next. And hopefully that's a reciprocal thing, that some of the things that you saw with us today are making you think about the work that you're doing and how you might incorporate some of the tools, data sets, research findings, policy examples that you saw today in the symposium, and think about what you might do differently going forward. So I think we should end it there. For anyone who wants to stick around and have a chat,